Hi, I'm Corissa Miller and I'm the project manager for the Virtual Learning Centre for Asia and the Pacific. And I'm going to talk to you today about the steps that we're taking to establish the VLC at the FAO RAP office. But first, I'll just share my screen with you. Before we talk about the details of the VLC itself, I just wanted to talk a little bit about why we are considering virtual training in the first place. The virtual training has been becoming steadily more popular over the past decade, and that was before the impacts of COVID-19 on delivery of training even impacted. So there's certainly a lot of benefits to virtual training. I've listed some of them here. It is accessible. We can train very large numbers of participants across geographically disparate areas and time zones quite easily. The materials can remain accessible online for as long as you wish to leave them up. And it is quite easy to get access to international and regional expertise because we don't need to physically have everybody in the same room at the same time. The format is also very adaptable. It's easy to translate materials from existing courses into new languages with very little relative cost. And that content can also be adapted to fit new context or new target audiences reasonably easily as well, because we're starting with a foundation of an existing course already a lot of the time. The training styles can also be converted. For example, something that many people are interested in the moment is the conversion of more traditional face-to-face training materials into a virtual or online format, which is certainly possible. And it's also very affordable relative to flying participants and the travel costs associated with that. It's also more affordable for the environment with a lower carbon footprint. And of course, we can, as I mentioned, we can repurpose existing courses, so there's no need to redevelop something new every time, which is a logical saving. So the VLC concept itself, it's very important to emphasize that it's not just a delivery platform for training. It's regionally based. There are people in a dedicated team who will be physically located at the FAO RAP office, and these people will have skills to not only help to deliver training courses and the logistics associated with that, but also in the development of training materials or conversion of existing materials into a virtual format. And in addition to that, all of the processes that need to surround training development and delivery to ensure a certain level of quality is adhered to, as well as performance. And so these training materials can be delivered in a variety of formats, as online courses, workshops, meetings, and other resources. And the benefit of being in the region as a regionally based or regionalized VLC is that we're able to better assess the specific needs locally, because we have more of a finger on the pulse for what is needed. And that means that we can also provide more tailored training to the region. And there's other things that the VLC can do in supporting virtual networking, promoting national cascade of training resources, and encouraging CPD as well. So until now, we've had a main or primary focus on training of animal health professionals, and that includes government and private veterinarians, and also other animal health personnel such as veterinary paraprofessionals or community animal health workers. And that training has been focused on improving capacity for management of diseases and other health threats in the region. But of course, this platform can be adapted and used for many other purposes. And I'd be interested to hear from you when we go to our discussion section next about some of the training priorities that you may be aware of or be working on yourselves outside perhaps of animal health even. So the VLC is certainly a very collaborative initiative. With initial funding for the first year provided by the European Commission for the Control of Foot and Mouth Disease, EuFMD, as well as really extensive mentoring and expertise from EuFMD for the VLC team. So this is in the form of training and in-kind support to actually provide some of the development delivery human resources, required to support the VLC as it's getting off the ground. And of course, the VLC will be hosted at FAO RAP, and they are also co-funding the initiative and have been instrumental in building the dedicated VLC team for getting this work started as quickly as it has. The VLC team itself will comprise of project manager, instructional designer, and operations specialist initially, and they will assist with delivering the training to the trainees, the relevant target audience. And there's also training focal points and an advisory group which will support the operation of the VLC as well. So there's some tangible steps that we need to take, and that we have, many of them we have already started to take to achieve this establishment of the VLC. As I mentioned, there'll be a dedicated VLC team based physically at FAO RAP office once travel becomes a practical reality. We are fortunate to have the support of EuFMD's virtual learning expertise, and at this point also their infrastructure and platform. We can draw upon the regional subject matter expertise of our FAO RAP colleagues and others in the region, and we'll be establishing training focal points and an advisory group, as I mentioned, to make sure that all of the courses and training that we do deliver remain relevant to the regional context. It's very important that we develop strong partnerships with our regional training providers and partners. We're not the only platform or organisation who will be delivering training in the region. And of course, trainings have been delivered very recently. And so it's important to work as a team, as a partnership with the other stakeholders in the region, so that we can work together to get the best result for the capacity building objective that we are trying to achieve together. Of course, establishing sustainable funding pathways and conducting training needs assessments are also very important steps. In particular, the training needs assessment, it is a cyclical or iterative process, because we need to make sure that any of the information that we collect through the training needs assessment is evaluated and fed back into that cycle, because of course training needs are going to evolve over time in the region, so it really does need to be a constant process. And lastly, there's the important maintaining a training quality management system as well. So the training quality management system, or TQMS, is really just a way to monitor the outcomes of the stages of the training life cycle, which are shown in the linear graph, a linear image below. And that ensures that each of these stages meets its quality standards. Excuse me. And this is important not only in the lead up to the training event itself, but afterwards as well, so that feedback and follow-up can be fed back into the redevelopment, update and improvement of the courses that are offered by the VLC to adhere to the high standards that we wish to. The timeline of achievements for the VLC. So we really are in the very early stages of this project. The concept and funding was confirmed in 2019, but the project kicked off just 2 months ago in September. And since commencing, as I mentioned, we've started to build the VLC team, developed a work plan, consulted with stakeholders, a training needs assessment has begun. So there's a lot of initiatives that are underway, but there's a lot to do because we have a very fast escalation in the demand and need for training to be delivered, given that there's a lot of projects that have training as part of their deliverables that can't be delivered right now. So we have already started to deliver some training courses in response to this. We were fortunate to partner with EuFMD to train participants from Asia and the Pacific region, as well as some staff from FAO offices in the region as well. And those were for foot and mouth disease, socioeconomic impact assessment, and the FMD laboratory investigation course with EuFMD. But in the very near future, later this month, we are hoping to make a lumpy skin disease open access short course, self-guided course available. And this is in response to the developing emergency situation of lumpy skin disease spreading through the region at the moment. So that's to try and provide some training resources as quickly as possible to the region, while we do adapt the lumpy skin disease tutored course for delivery in January. So the short course is, I guess, being delivered as a taster or a preliminary course as a precursor to this full lumpy skin disease tutored course to be delivered in January. And then very exciting, the actual launch of the VLC will be in early 2021. Now, there's a number of different types of courses or modalities that virtual learning can be delivered through. So it's not just the one option. So I thought I'd give you a quick overview of them. But the self-directed open courses and the tutored virtual courses for large audiences are going to probably be the most popular or most commonly used courses that we see through the VLC. But there are other types of courses. There's in-depth virtual courses for smaller groups that are more intensive on specialized topics, virtual workshops, which are essentially replicate the physical workshop environment as closely as possible to facilitate group work and live webinars and tutors. And then there's blended learning as well, which is essentially a combination of virtual and face-to-face learning options. But FAO RAP colleagues should be reasonably familiar with the EuFMD virtual learning platform, because EuFTAD RAP was recently involved in developing an African swine fever preparedness course for Asia and the Pacific, along with EuFMD colleagues and with the regional office for Europe as well. And credit to Uni O for providing these slides and her review of the course that was delivered by EuFTAD RAP. It was a 4-week self-learning tutored course, meaning that it comprised of live webinars, interactive modules, quizzes and assessments, as well as discussion forums. And there were 487 trainees from 27 countries, so that's a very big course. Normally we see them top out at around 400 or 500 participants. And there were 12 tutors and other observers also involved. And the weekly discussion forum was very large and active, with over 300 users engaging each week and over 6,000 views per week. So it was very busy. And uni has provided us with a breakdown there of the ages and the genders, and also the completion rates for that course. And that's one thing that we do see, is that the did not finish, partial completion and full completion depends. They do vary between regions and the target audience quite significantly. But when you have a very large cohort like this, you do expect a similar percentage will not complete compared to a smaller group. So I will leave you here for a minute, just while I share my screen, because we've done a lot of talking about virtual learning environment. Now I'd like to show it to you. So this is the EuFMD virtual learning platform, their Moodle. And this is the front end. This is the Lumpy Skin Disease Preparedness Pilot course. And this is the course that the Virtual Learning Centre for Asia and the Pacific is looking to adapt to the regional context. So we will make one of these modules, week 1 here, into a standalone open access module available this month. And then we'll also adapt the entire course into the entire tutored course for delivery in January. So this is the standard format where we have a discussion forum, and there's different threads dedicated to the different 4 weeks of the course. We can see if we click on the discussion forum, I won't go into it in detail, but essentially the tutors or the trainers can post questions. The participants can answer those questions or post their own questions, and then they can answer each other's questions, and that really stimulates a nice level of discussion and, I guess, peer interaction as well. So there's also the interactive modules themselves, and these will come with a pre-course survey. Just have a quick look at this one. But essentially the pre-course survey is designed to assess the competencies of the trainees before they take the course against the learning objectives of the course, and that helps to assess how effective the course may have been in training them. There's also webinars, standardly an introductory and an end of course webinar. I won't click on these because we're already in a webinar, so that would be a webinar inception that I'd risk creating. And then there's also options for feedback in each module, as well as an overall feedback option at the end, which I can show you shortly. And then there's the modules themselves. So this is study module 1 for the lumpy skin disease course. It's just going to take me to where I was last in this course. I'll take you to the beginning quickly. So this is what a typical virtual learning environment might look like in a tutored course. And this is just in an interactive module. So you can see that it's reasonably intuitive. We've got clear learning objectives set out. There's lots of pictures to support the text, to aid understanding. If for instance, English as a first language, if English isn't a first language, or understanding general literacy is not strong, then we can support with images. And the text itself can be translated reasonably easily as well. There's interactive elements to the course. There's often images or icons that we can click to get further information. And it is, of course, just aimed to be very visual. There's also often links to additional resources for extra reading. And it's just designed to be as simple as possible for participants to work through on their own. And this is a neat little image of the spread of lumpy skin disease into the region, which has now gone further down into Southeast Asia. So it's this is a good demonstration of why our quality management system is so important to ensure that slides are, or the course content is updated before it's, and adapted before it's released again. So as you can see, it's very visual. There's also the option at the end here to complete a quiz to test your own understanding of the module and the contents that you've just viewed. Then if we go back to the course page, you can see that there's 4 weeks of those modules. There's a resources section where we can include resources from FAO or our partners that are relevant to the target audience or target region. And then there's the overall feedback survey for participants to provide feedback, and that's not only important to ensure that the courses can be improved, but it also assists in identifying other needs for the region, as well as part of that training needs assessment process. Okay. So that's a crash course in what the VLC is hoping to achieve in the near future, and the steps that we are taking to make that happen. I hope that you now have a bit of a understanding of what is possible with the VLC. And I look forward to hearing your suggestions for the kinds of training that you see as being a priority for the region, and also to hear about some of the work that you're doing that you may need assistance with to develop or adapt training materials and deliver them. So thank you for your time.